Assalamu alaikum. We are joined here today with Ma'am Maliha Latif and Maqbool A Babri, also known as Max Babri. These are two big pillars of the Pakistani psychology community, and we are going to have a conversation with them about not just psychology but their experience and how we can perhaps guide students and prospective people who want to work in Pakistan in the field of psychology to get some knowledge about how we can practice psychotherapy or work in various different settings that use psychology. So, thank you for having us and hosting us. And if I can just introduce you two very quickly, I think that everybody can find out a lot about you on the internet, but just to summarize it, you are the CEO of the Consultants company, and alongside that, you direct the Wellness Center as well. Could you tell us just a little bit about what these two places are?
Yes, me and my wife, we are partners in two companies. One of our companies called the Consultants, and with the Consultants, we offer team building, leadership strategy to large organizations, and we also do anger management and fear management, delegation, visioning, and that's one company, and that's mostly for corporate sector. And then we have another company called the Healing Center, and this Healing Center, of course, we offer psychotherapy, hypnotherapy, and lots of therapies, and also counseling and coaching and relationship therapies. That's what we do, and we're very happy with our work, and we are, alhamdulillah, we have plenty of clients, and things are working out quite good for us.
That's wonderful to hear. No, it really is two different worlds, corporate, and then there would
Yes.
be healthcare, and you're bringing them together. And Maliha, how would you explain your role these days? What exactly are you working in?
So basically, I'm a clinical psychologist, and it's been 29 years that I'm working in the field. So if you, as you were asking recently, I think recently I'm more into working with children and mainly specifically autism. So lately, autism has become very widespread. There's a lot of awareness that's coming in, and there's a lot that we are also doing. So yes, being a clinical psychologist, I'm involved with children and speech therapies, their childhood disorders,
Right.
and with respect to that, bringing awareness into schools, developing this mainstream and bringing inclusion programs together.
Right.
So that, to bring community where people lack some sort of or are facing some health issues,
Right.
they should be merging with regular people in our society.
So you both being clinical psychologists are not just working with the person needing the mental health, but also different organizations that play a big role in facilitating mental health. For you, it's the school system, and for you, it's the corporate sector.
Yes, the corporate sector as well as the individuals.
Yes.
I just might clarify here that when I did my master's and wanted to study further, there was no advanced diploma in clinical psychology. So unlike Maliha, I have not done an advanced diploma in clinical psychology, although I have studied more in clinical psychology in Sweden as well as in USA, and did clinical hypnotherapy from there.
Right.
So traditionally, some people might have issues with me calling myself as clinical psychologist, so be mindful of that. And I want to make this statement upfront. I'm very proud of Maliha. Maliha and I, we have, although we have a lot of age difference, but we have been in the same classrooms in different roles. And I'm very proud of Maliha, especially because she's one of my former students. And not only at the advanced diploma in clinical psychology, where I was teaching growth groups and gestalt and sensitivity trainings, and a lot of interesting stuff that is important for psychology. But also, because she's also done, to begin with, she did this clinical hypnotherapy with me as well. So she's also a hypnotherapist, although she doesn't talk too much about it. Before she went to England and did some more occupational therapy, also environmental therapy and lots of other therapy works, therapy things, and also hypnotherapy. So this doesn't come to the front, and she doesn't talk about it very much. So she has been to great therapists and great schools.
Although I practice it, I love it, and I've seen good results.
Right.
So majorly, my initial therapy was with Max in Pakistan. That was back in 2002, 2001 or 2002.
Mm-hmm.
So he he built our levels like anything. It was 80 hours. I did 80 hours of training with Max, and it was amazing. I think nothing can compare to that. I was too much inclined towards hypnotherapy, and Max has always been a mentor. First a teacher, but then a mentor for me till today. And then later on, I think 4 or 5 years later, when I went to UK, so I was practicing the same thing. Armin McGill was visiting with Tom Silver and some other hypnotherapists from USA. So I attended his, I wanted to see him, first-hand experience. But after my training, and in the end, that same night, I called him up and said, Max, I think you are, or he was like nowhere different than what I learned from you. Mm-hmm. And that was a true statement. That was, I think I could have not relate or understood Armin McGill if I hadn't have had these trainings with him. So my basic training, my credit for the cases that I do with hypnosis, I still practice it the most when limited cases that I do. So the credit, I give my credit to Max. And I told this to Armin McGill as well.
Yes.
I told this to him as well.
Yes. And he's a remarkable man. We lost him.
Yes.
Allah Ta'ala usko uske darajat buland kare. Another thing that I'm very proud of, Maliha, I started teaching at clinical psychology at the Punjab University when they didn't have an advanced diploma. And I introduced some other subjects, like I introduced industrial organizational psychology, because I thought these people must get jobs.
Yes.
Because we were producing psychologists and more psychologists and even more psychologists, and nobody was getting jobs. Mm-hmm. And of course, clinical psychology diploma was good because almost everybody got jobs. But I wanted them to have jobs which is more than just a government job. Mm-hmm. And that's what makes me very proud of Maliha. Because Maliha, within a few years, was able to set up this impact and give jobs to a lot of psychologists and budding people. Yes. And I think if you look back, you must have more than 100 people must have passed through as clinicians, as support people. And right now, how many are working?
I think we are around 30, 35.
30. No, somebody giving job to 30 psychologists is very big in Pakistan. Very big. I'm very proud of you, Maliha, and salute to you. That's remarkable. There's no other psychologist that I know who's started something private and has been able to provide jobs to so many psychologists.
MashaAllah, I think you've covered some very important points. I think having good teachers makes a very big difference, and the way you describe your relationship with each other as this, learning center, and then eventually how that grew over a span of 30 years into including and expanding psychology, not just towards this pathologized way of practicing, but into other fields, and it gave a lot of students this vision of how they can apply their degree, not just in this clinical setting, but also transfer it over to industries and organizations, in your case, schools in yours. What are some particular things that you would say that you're very proud of yourself? And you said that you're proud of Ms. Maliha. So what are some things that you both are individually proud of yourselves and the work that you've done?
I like Maliha to first talk about this. So I talk so much. It's so easy for me to talk.
We often don't give ourselves credit. So,
that's true. That's true. So I think in this entire 30 years of practice, I think I have worked as an employee for 2.5 to 3 years. And then later on, I've had this, I think you can call it, I call it Kira. Okay, I want to do something. I was very passionate about, doing something different. And then I've had him as a mentor, and he has been with me throughout, encouraging me. So I think yes, impact is, I think it's a big achievement. And if I look back, and the other day I was looking at my staff, because I started off with one room, and me and another therapist, and very limited material and stuff. And then we kept growing. Meanwhile, I had 2 years break as well because I went abroad for studies. Came back and then I started again. So yes, and I never stopped. There was something in me, and he was there to encourage me. And today we are so many. And the good thing is that I think I personally feel being a female, Shadi never stopped me. Having a daughter never stopped me from working. So yes, I kept managing myself.
Right.
And today in my team, psychologists mainly are girls and females.
True.
So now, and there was a time when a girl used to about to get married, leaves her job, go home. So they were just working for the sake of they were just waiting for the marriages to be done. But now I have in my team so many girls who are married. I encourage them, and at the moment I have 3 or 4 girls who are pregnant as well, and they are passionate about their work, and I think I feel so proud of them. I honestly, because it feels like empowering women. So I feel so. I've told them, and I keep telling them. Just like you were encouraging me, I keep encouraging my people, because now I think I'm also growing older. So it's my responsibility now to have that thing in younger generation. I think that way, and then I wanted to do so much in life. But I was so impressed with Max. I still am, honestly, as a person, as a therapist, as a hypnotherapist, in every way, he's remarkable. So yes, I kept my assessment side alive, I kept counseling side alive, and now we are working with special children as well.
Right.
So, and we have clinical psychologists in every domain. So if I'm not seeing many clients for counseling or therapy, but we have 5 therapists who are doing it, the therapy.
Wow.
And we have 2 therapists who are conducting assessments.
Wow.
So they have their different domains. They can see a lot of things. So
So what I'm understanding is that you built an organization, and what you're proud of most is that you are breaking barriers in society which typically keep people out of work, and women in to be very precise.
Yes.
Psychology, there's a lot of stigma around the field, and then being a woman in Pakistan has its very real challenges, and you managed to put it.
And there were times, 15-20 years back, there were times when the young girls used to come apply for a job here, and their fathers or mothers, they used to come and we want to see who Miss Maliha is, who's your boss.
Yes, that's right.
So they used to feel so comfortable, and they would say, your daughter is just like my daughter, don't worry, it's a very safe place.
A safe space.
So yes, gradually then I think this is something I've forgotten as well, now that we are talking about it.
And this is now happening at a school for special needs students. And how about you, Max? What's the most proud?
I think, I don't know. I mean, I am humbled by the acknowledgement that I've been able to receive. I'm privileged that I had the opportunity of teaching at Advanced Diploma Clinical Psychology, and they thought, well, even if I had not had an Advanced Diploma myself, but Dr. Rafi Hassan, who was the first director, thought that I would be an appropriate person to teach there. So that's a big acknowledgement. So then I taught interpersonal skills at LUMS, visiting faculty for 30 years. So that was remarkable. I've taught in Sweden, working condition and environment and psychosocial working environment, and that was remarkable. So worked as a consultant there and had an opportunity to study in US and also work there. But what really I feel good about myself is that I have always encouraged people, appreciated them, opened doors for them, told them, yes, you go ahead, you can do it, you will do it, you will be successful. And I see the results, and I see so wonderful. And of course, my family is involved in everything. And I know Maliha and I also, by the way, kind of family, because I know her husband Asad very well. He's a good friend of mine. And I also knew her parents, and I also knew her 2 brothers and her other sister, who's 3 sisters they are. The oldest one is married to another friend of mine. One is in is she here now or is in Saudi Arabia?
They're all here.
They're all here. So, and I work with them. So, we are family and we have a great relationship. And so, I think I am humbled rather than be proud of anything. Humbled that opportunities are folded out in a way that things are good.
Yes, it seems like that you have a way to really approach and work with people, and you have formed a lens almost, it seems like, in terms of being promoting compassion in people and also in your practice. I believe I was watching a small interview that you gave very informally, and you said something along the lines of how a person is the expert of their own lives.
Yes, that's the therapy model that I have. For people who come to me, they are not called clients or they are not called patients.
Right.
They are co-counselors. For example, if Maliha would come to me as a client, then and if you're meeting for the first time and Maliha has come to me because she's seeking therapy, then Maliha is the expert on who Maliha is. I cannot be an expert on who I am. So we have done co-counselors, because we are equals. Co-counselor is a very enabling, equal position. It's not judgmental. It's not that somebody is tanking another person. It is sharing of whatever we have. So I would request Maliha to let me know what are her experiences, and her experience, because of her experiences, she might have assigned certain meanings to those experiences. So I am an expert on reassigning meanings to our experiences. So she will tell me these are meanings that I have assigned. For example, if one is angry or one is upset or one is dejected or one is feeling low or one is getting into depression or one is full of anxiety, this happens because we have assigned meanings to our experiences. And those meanings have some connotation of reducing your own value in your own eyes. And that is what causes problems. So I help people reorganize and re-understand and revisit those experiences and assign new meanings. So if somebody is treating me badly, it is not necessarily a judgment call on me. It is possible that that person is in a bad place or that person is in pain. So if that person is in pain or in a bad place, why would I reduce my own value in my own eyes? So this is how my model of therapy is.
It's a very, well, I think that it matches a lot of the qualities of being, it's a non-hierarchical approach.
Absolutely. I mean, if a therapist is supposed to help, no, transformation doesn't take place by prescribing medicine or prescribing behaviors. Transformation takes place through inspiring people, through helping people recognize how wonderful they really are. And if they are that wonderful, why would they think that they are not going anywhere?
It's a collaboration.
So this is how this works, and this is the essence of hypnotherapy as well. Another thing that I feel good about is that one should not give up on one's dreams. I don't know how long this interview is you're going to keep it, but I like to share this, that when I was in class 5 or 6, we had a teacher from UK, and she was teaching us geography. And when we were looking through the atlas and looking at the countries, and we were talking about Scandinavia, and I, as a 11-year-old boy, when she said, "Oh, Sweden and Scandinavia is beautiful, lot of lakes and lot of rivers and lot of water and very beautiful women." Oh, wow. So that was, I thought maybe I get married to a Swedish woman, who knows. So that was a dream. And I was good at cricket. So I was playing school cricket. I'm the only son of my parents. My parents have passed away. So my dad said once I played cricket up to FSC, and then I came to government college, and I was the part of the cricket team with some great names. I don't take any names right now. So my dad said, "No, you're not going to play cricket. You're going to focus on studies and focus on studies." But my dream was to wear this blazer with the Pakistan color on it. So time passed away, so I kept writing to PCB that they should do team building and leadership and strategy. So in 2009, when Ijaz Bhatt was the chairman, I was invited to talk to them, and so they said, "Okay, we want you to work with the team that's going to play the 2009 World Cup in England." So, and then later on, I went to India in 12-13 as a member of the Pakistan team. And this now also I was part of the team which went to for the Asia Cup in Sri Lanka and the World Cup in India. So of course I had received this blazer 3 times. So I'm saying never give up on your dreams. So whatever you dream, and I tell people, whatever you dream, go for it, never give up. Things will happen, you never know. But be honest, be committed, don't try to bend corners, do your best, be grateful for what you have.
And that's a wonderful message, definitely something that we should all, work hard in preserving. But just to come back to what you were talking about, as a practice, the co-collaborative effort, not overly pathologizing, and कि डॉक्टर को मिलने जा रहे हैं तो आपकी एक हायरार्की ऑलरेडी आ जाती है कि ये बंदा मुझे बताएगा. When you started working in this field, and this question is for you as well, ma'am, what was the state of psychology in Pakistan 30 years ago, and what are some big changes that you've seen happen? And
Maliha, you take this.
I think people are quite open about it now.
Mm-hmm.
They do talk about it, and there is no shame when they talk about their issues and they want to consult some therapy, some counselor therapy. So they're seeking therapies, and they're very comfortable talking about their issues. I think if I see there's a lot of ethical practice as well in our psychologists. So I haven't heard of any breach of contract or a breach of confidentiality. So people are very easily approaching psychologists or therapies, and they're getting help out of it, and then based on that they're recommending further people.
Right, okay.
So yes, I see.
See a positive change.
Yes.
It's been growing. The recognition is there, and now people are
recognition
accepting
is there, acceptance is there, and families of the dada dadis and generally the older people, they are also accepting of seeking such therapies.
Yes.
I agree with Maliha. There is a lot of acceptance and a lot of clarity. I am lucky in the sense that people who come to me, I call them healthy people, because one, I don't see reference. For example, if you say, okay, I want to bring my brother, so I'm appointment dated, I'll say, okay, tell your brother to call me. No? So otherwise, no, but the mother said, no, my son will not come, he will not come. Well, we'll bring him to you. I said, no, if your son will not come and you will bring him to me, I urge that you come and do counseling with me so that you can take care of your son rather than pushing him. So because whenever I am a little interested in existential psychotherapy as well. And existential psychotherapy means sometimes the system is sick. Not the person, not the individual. So the system sick could be parents also, by the way. They are also part of the system. The society at large, the community at large, the judicial system, the policing system, everything. So then people must react to that. And when they react, then we say, oh, this is not normal.
Right.
And so this abnormal normal is a very controversial issue in psychology. What is normal and what is abnormal?
Right.
Because should a person be so clinical and sterile that doesn't have emotions and feelings? गुस्सा आता है जी इसको तो क्यों ना आए, अगर उसके साथ ज्यादती हो रही तो गुस्सा उसको क्यों ना आए जी वो कहती है बड़ा ये रोना शुरू हो जाता है, अगर उसको दुख लगा है तो क्यों ना रोए, ठीक है, हंसता बहुत ज्यादा जी, किसी चीज की खुशी हुई है तो क्यों ना हंसे. So why does society wants to clamp down on expression of feelings? So I you send this. So when I talk to people, when they want to come to me, I ask them, why do you want to come to me? What do you want to fix? And if they say, no, I think everything is all right, my mom says that I should come to you. I said, please send your mom. I don't need to see you. Or khuda na khasta, sometimes it happens that I miss something, a person comes and I ask, because my first question that I ask somebody who comes to me, my co-counselor, is, why are you here? And if this person says, I don't know, or my mother sent me here, and I said, okay, no charge, session concluded, please come when you want to come. I'll take the hit. I won't charge you. Okay? So I ran this. Now, what does that do? People who come to me are healthier people because they want to change themselves. Imagine people who are unhealthy, they want to change the world. People who are healthier, they say, how do I adjust to this world and change myself so that I am not miserable? and I don't want to make other people miserable. So that's what therapy is all about, from my point of view, the way I look at it.
See. Okay, so we've had a wonderful conversation about many different things. I hope that this has been informative to the people watching. There is one thing that I would like to also just bring on. Psychology and psychiatry work together. Is this the case in Pakistan? What are the challenges that these two fields are facing, and are there examples of good collaboration in both psychology and psychiatry, particularly in Pakistan?
Maliha?
I think this has never been a good relationship in Pakistan, although we cannot work without each other. It's a very understood thing because we are mainly working with through therapy, and we're not using any medication. And the psychiatrist is an MBBS person, and they're dealing with the medical aspect of the problem. So yes, we both need each other. So at being a clinical psychologist, I am seeing clients, and at one point I feel that now this person or this condition needs medicine or pharmaceutical. इसके अंदर क्या कहते हैं कि होनी चाहिए, कि एडिशन होना चाहिए, then definitely हमें रेफर करना है साइकाइट्रिस्ट को. सिमिलरली एक रिस्पॉन्सिबल साइकाइट्रिस्ट की भी रिस्पॉन्सिबिलिटी है कि medical aspect ho gaya. Now if they want to deal with some subconscious aspects of the problem or some other relational aspects of it, so वही counselor का काम है. So we working with the same thing, but our roots are different.
Right.
But and we cannot work independently. Means we cannot work without each other's acceptance or support. But unfortunately, this is not the case in Pakistan. We have always been rivals, kind of a thing. Maybe I'm hopeful because there's a lot of debate these days, and we are trying to bridge this gap in a positive way. And there are psychiatrists who are also accepting their role and a psychologist's role. While working with them.
And I know that in autism you work closely with psychiatrists and you're a clinical psychologist, so it is happening. It's possible to happen.
It is. It's a need of the work.
Right. And what are your thoughts on this?
I think one, of course, like in autism, I can also talk a little bit. Maliha is the expert in that area. I will certainly talk about psychiatry and psychology. So I think the first thing is to be able to identify what are the concerns of a person. Are they psychological concerns or are they psychiatric concerns? Now, what is the difference between psychological concern and psychiatric concern? Psychological concern is when something has to do with behavior and thought process. So that's purely a domain of a clinical psychologist or a psychologist. And then, because that have been so prevalent, that the chemical balance becomes little disrupted. And when the chemical balance becomes disrupted, a person is not open to intellectual conversation and logic and reason. So to prepare the person for logic and reason and intellectual interaction, the chemical balance has to be restored. And of course, a psychiatric plays a very important role in providing that chemistry, that psychological balance can be restored, and a counseling coaching can be done for transformation of thought process. But the healing takes place when the thought process changes, not just the chemistry that changes, because the cause of chemistry disruption is a thought process to begin with. For example, this is a perception. If there's a perception, I hope इरफान से मैं पूछता हूँ कि साथ वाला कमरा बंद है कि नहीं, because हमने उसमें ना एक खूंखार शेर को बंद किया हुआ है. These are only words, but this creates anxiety in all the people sitting here. ठीक है, पता नहीं कमरा बंद है कि नहीं बंद. ठीक है. So that means that it is because of perception. So it's consistently perceiving things in an inappropriate way. It begins to upset our chemical balance. So chemical balance can be restored. That's a treatment. That's not the healing. Healing and treatment is a different thing. Treatment is, like खांसी हो रही है तो खांसी की दवा खिला दी, या blood pressure high है तो सर दर्द हो रही है तो पेन किलर दे दिया. But healing probably is कि blood pressure control करना है, जिसकी वजह से सर दर्द हो रही है. So this psychiatrists play a tremendously important role in all this. But I think psychiatrists also it's important for psychiatrists to also acknowledge the thought transformation cannot only be done by medicine. A psychologist and a clinical psychologist is also needed to impact the thought process. So we respect psychiatrists tremendously, but psychiatrists feel sometimes insecure. Okay, if they let psychologists also play an important role into this, we will probably erode their practice or their systems. So this is a little complicated, but I think it's important that qualified psychologists continue to make an impact and continue to work together with psychiatrists and make them feel secure and work as partners rather than subservient to one or the other.
Right. It's again, I think, yes. Is there anything that you would like to add to that?
No, that absolutely is right.
Right.
I agree.
There's a lot of different things that we've covered in this talk. I think so many dichotomies of subjectivity, objective, what's normal, abnormal, these labels, and working with systems and working with an individual. So it's been, I think, it's been very informative for me, and there are so many other questions that I wish I could ask.
I have one more comment to make if we have time. And that I was saying that, for example, in adult therapy, it's important that the adult who's coming to therapy has his consent.
Yes.
So we were talking about consent, and I don't say people. As children are concerned, early 3 years, 4 years, 5 years, even up to 7 years, parental consent is more important than the consent of the individual.
Exactly, yes.
Because certain things parents notice, but the child cannot notice, and child does not know the options that are available. What is autism? As I look at it, autism is a state in which others perceive that this child is socially inadequate.
Right.
In learning, in behavior, in language, in showing emotions, in interacting with people, in deciding things, in showing of emotions. And certainly that doesn't necessarily mean that there is something wrong with this. They have a language. That is not necessarily my language. So a good school or a good system will learn their language, allocate people who would learn their language and then communicate with them and evoke their emotions, and things will eventually work out. So this is what it is. It requires more attention giving. It requires more patience, it requires more understanding, it requires accepting the person the way it is. And if we have such people, it is not necessarily something wrong with us as parents, or it is not a punishment from the Creator. It is a great opportunity to take care of a special person. Only special people are granted that privilege.
That is true. I think it really hits the nail on the head when you talk about, not just thinking that the child is looking for attention, they deserve that attention. So it's about how we look at the problem, which might not be a problem for the child, but it is for us. So it's an introspective field that we're in, and it can help, we can project it in a very positive way, hopefully. Just while I have you, sorry, there's one more thing that's just come into my mind. There is a big, the reason why we have confidentiality, consent, and these ethics in place is to know when we can also perhaps break confidentiality. And one thing where confidentiality is supposed to be in breach of, or not breach, but like you have to step aside from it, is when there's a rational belief that the person might commit suicide or harm themselves. Given that we're living in Pakistan, how can we help provide this safety net to people whom we might come across as, they're contemplating suicide or have had suicidal attempts? What resources can we use to help prevent or protect them from this?
I think there are multiple questions. So I would like to first clarify that there are two situations. One situation is that this person will harm herself or himself. And the second situation is that this person could harm somebody else. So in both cases, we can breach confidentiality. According to the American Psychologists Association, we are allowed. So if somebody says, now I'm going to go out and kill so-and-so. So I have an obligation to see to it that I don't become an accomplice by not reporting this.
Right.
So I do that. And of course, if this person is going to harm herself or himself. So both cases reporting. Now, how do we how do we do this? It's not easy. But I can give you a case example. A mother calls me and says, my son is going to commit suicide. I said, okay, I'd like to talk to your son right now. Many years ago, this happened. And I talked to this guy and I said, I'm a scientist. And this is not necessarily a guidelines for people who deal this. I'm just narrating an experience, and this is not a guideline for anybody else.
Yes.
So I talked to this guy and I said, why are you contemplating this? So he said, this, and this. I said, I don't understand. Why don't you come tomorrow, visit me, and we'll discuss this. And if you convince me, let's see how we can help each other. Okay. So, but please come well dressed. You work in a bank, so come well dressed, because if you convince me, I'll support you. And if I convince you, I will want you to go to the bank.
All right.
Okay. So come and talk to me tomorrow morning. So he came. Now he's a very successful lawyer somewhere in the US. So what happens is, the first step is to find way to, in the moment, disconnect. In the moment, because the most dangerous things happen in the moment. So this moment can be somehow delayed. You know. So if he had said, no, I'm not coming, then I would have said something to the mother again. But since he agreed, and he agreed कि यार क्या पूछा मैंने क्या पहन के आओगे, अच्छे कपड़े पहन के आना, you're best one, because even if you're going to meet your maker, I want you to be well dressed. Yeah? And if you're going to go to the bank, I want you to be well dressed. Okay? So, but please, it's not guidelines for anybody that you should do this. This happened, I was lucky, he's all right, and things survive. But I'm not providing this as a guideline.
Yes,
and guideline is, see to it that the moment passes.
Right. Okay.
So it is delayed, and then of course there's time for therapy.
Thank you. That's helpful to know. I think there's been a lot of things that you both have shared in your experiences that I'm hopeful that people can learn from, and they do see psychology as a field, as a career path that they can choose to go towards in. And thank you for your time, and God bless.
Thank you.
Thank you.
Thank you.